Hello, everybody, and welcome to this webinar, which is jointly organized by the European Disability Forum and the ONTE Social Group. I hope that everybody is well, and I would like to thank you very much for attending the webinar. Today, we will be talking about a very pressing issue for persons with disabilities. This is the way that the EU's response to the COVID-19 pandemic will alter how EU structural and investment funds are used and how it will affect the way the EU supports persons with disabilities more generally. Before I hand over to our moderator today, who will be Javier Güemes from the ONTE Social Group, I would like to share with you some logistical information and some housekeeping rules for how this webinar will work. So you can find the link to access the real-time captioning in the chat box. The chat box should be located on the right of your screen. And in the tab named Handouts, you can also find the full program with speakers. As some of you might have noticed, the webinar will also have international sign language interpretation. I should also point out that all participants have muted microphones and EDF is controlling the permission to unmute. So don't worry if you're trying to unmute and you're not able to. This is completely normal. In case you face any technical issues, you can write to my colleague Raquel using the chat box and she will reply to your concerns. Throughout the webinar, I would invite you to ask questions to our panelists using the question box. So the question box normally is below the chat box. You can ask these questions at any time, and we will do our very best to leave as much time as possible at the end to answer these. When you are asking a question, if possible, please indicate the speaker to whom you would like to ask the question, so we know that the correct person is answering. And then finally, before I hand over to Javier, I would just like to thank our interpreters, Ferdinand and Tina, and our live captioner, Wim. I would like to thank in advance all of our speakers for taking the time to be with us today, and of course to all of you listening for your interest in the subject. So without any further ado, I will hand over to Javier Güemes. Javier, the floor is yours.
Thank you very much, Hayden. So welcome to everybody, and thank you for joining this webinar on the EU structural and investment funds and the COVID-19. As Hayden was mentioning, this is one of the most pressing issues because we know the impact that the funds can have in the inclusion of persons with disabilities. Definitely now, in this period, it is very important to detect if all the flexibility measures that are being taken today for the structural funds and how are they being implemented at national level, and probably also the impact that they will have in the negotiation of the future programming period, if they are really getting to their purpose of the inclusion of persons with disabilities. So today, in this webinar, what we are going to establish is a dialogue between different experts in this area, experts coming from the disability movement, from service providers, from the European Commission, and for the implementation at national level. So I think the panel is really very interesting, and I think they will have really very important things that can be afterwards taken on board for the future and for the way in which the structural funds are being implemented at national level. So I would like, first of all, by invite to start to Yannis Vardakastanis, who is the president of the European Disability Forum, and he will address us. He also has a very long experience, not just in the disability movement, but also in the implementation of the structural funds at national and at European level. So I would like to invite Yannis to start and to open this discussion webinar. Yannis, please, the floor is yours.
Thank you, Javier. I would like to thank the EDF and the ONTE Social Group for organizing this webinar. and all those who have worked to make it happen. Indeed, this is a very important issue we're going to deal with today. Indeed, the structural funds are very important, not only during this extraordinary COVID-19 crisis, but also at times of so-called normality for investment and for investment in services that affect persons with disabilities. And we know very well, both in EDF and in UNTE and in other national organizations, like my organization in Greece, like the Latvian organization that is with us, service providers also know quite well. Luke represents them today here, that we have worked very intensively to include very strong provisions in the regulatory frameworks for all funds in all programming periods. And we have been working also for the new period in the last 2 years. But before I say a few more specific words about the way the structural funds can and should be used to support persons with disabilities and their services, I would like to make a few general remarks. We should never forget and ignore the fact that the COVID-19 pandemic has brought Europe to its knees. This crisis is the deadliest crisis ever after the Second World War that Europe has faced. And that a great number of the people that have died have been in institutions, in residential settings, elderly people, persons with disabilities, so-called, in my mind, forgotten, invisible people. And this should be never forgotten, because what we owe to those who have died is to work more and more to make sure that the economic and unfortunately the social crisis that will follow the hygienic one will not be the real blow to persons with disabilities in Europe, to their services, and of course, to their rights. I spoke already about persons living in institutions. We can discuss about the livelihoods of people. We can speak about the situation of community-based services, the way they have been functioning, shortages of staff, etc., etc. Certainly, Luke will speak more about those. What I wanted to really emphasize is that the disability movement at the European level and at national level, with our colleagues and friends at all levels, should work and provide a new vision to persons with disabilities, persons with chronic diseases and their families for the future. If we are to answer to ask the question, has the flexibility that has been given to the member states to utilize the structural funds, has this flexibility been of any use so far for services to persons with disabilities? I think the answer is very little, if any. Very little, if any. And this has to do with the way member states have dealt with this, but also with the way the EU itself has led this. We would like to see a statement, for example, from the President of the European Commission, the President of the Council, the President of the Parliament, a joint statement, like the statement issued by the Secretary General of the United Nations. We would like to see the European Commission requesting the member states to really put in place the safety nets mechanisms to protect the most vulnerable to the COVID-19 crisis, but also to what is going to follow. And the structural funds have to be utilized for this. But also, my third and last part is that now we have long discussions about what comes after. What comes after in the Union, both at the EU and at national level, should concern and affect positively all European citizens. All European citizens. Persons with disabilities, their families should not be left, not behind, should not be left out, should not be put aside. The COVID-19 crisis has changed the realities we had before. In my opinion, the COVID-19 crisis has defeated the globalization as we have experienced it so far. It has also defeated the long-lasting attempt to deprioritize investment in public health systems, in social protection systems. We need in Europe to return to the roots. We need to return to the values that we have had in Europe, and that those values have made Europe the place to live. The new situation should put at the very heart persons, European citizens, their rights and their needs, and the new economic and social models that we are going to have in our economies, in our societies, should be rights-centered, inclusive, and not exclusive to those that will have the capacity to influence the political and the economic systems. At the end of the day, if there is one thing positive, and I conclude with this, from this pandemic, is to follow what COVID-19 does. It does not discriminate against anybody. So we need to work to turn it around, that the new way forward in Europe does not discriminate against any European citizen. Thank you.
Thank you very much, Yannis. Thank you for this intervention. Definitely, structural funds is one of the European policies that requires the will from the state to implement it correctly, but also a clear message as well and clear regulations coming from the European Commission. So this is something really the two components that are required to have a good implementation of the funds and making sure that they have the good impact. But now let's move to the European Commission. This was a very clear message sent from the European Disability Forum, from its president. And now we are going to give the floor to Emmanuel Grange, who is the head of unit for disability and inclusion from the European Commission, that will start a series of 3 interventions from the European Commission on this issue. And we would like to thank the European Commission for really taking this effort to participate in this webinar. And I think I've been informed, Emmanuel, that you will be unmuted, and you have to unmute yourself as well to intervene. So please, the floor is yours. And please remember, you have 8 minutes.
Thanks a lot, Javier. I hope you hear me well. I'm sorry I cannot be...
Perfect.
Okay, good. I'm sorry I cannot be on video, but the connection is only through my phone. So thanks a lot to EDF and ONCE for having organized this webinar. And thanks to Yannis also for his opening words, always strong as usual. It is important for us, the Commission, to keep a close link with our NGOs and especially EDF, who is a major partner for us. Thanks a lot also for the recommendation and advices received so far from EDF and from other organizations. But EDF has been very active in defending persons with disabilities in the crisis, interacting with the Commission and ensuring that persons with disabilities were not forgotten. I think that the reason why this active involvement was essential have been clearly summarized by Yannis, and I will thus not repeat them. My colleagues Anna Maria and Andor will give you very useful information on the role and the possible use of the EU structural funds in the context of the COVID crisis. So I will not deal with these aspects also. In fact, I will focus on 2 questions. Will the future disability strategy be adapted to integrate COVID-19 recovery efforts? And second, how do we foresee the strategy ensuring persons with disability are not forgotten in this process? So first, about the adaptation of the future European disability strategy to the COVID recovery. Even if I'm not entitled to disclose the content of the future strategy, because it's still under internal discussions, it is obvious that it will have to take into account the impact of the crisis and the way to deal with the recovery. Whatever the structure of the future strategy will be, we already know, all of us, that the impact of the COVID crisis and the recovery will touch many areas in which the Commission can act on, or where it can support the member states. It will thus have to be taken into account in a transversal way. Healthcare and social services are obviously the first areas we all think about, that's clear. But it's also obvious that the COVID crisis will have a huge impact on employment for everybody. In consequence, it will have an impact on persons with disabilities who already face important issues in accessing employment and getting reasonable accommodations. The same applies for what concerns inclusive education, distance learning, for example, which notably showed their limits in terms of accessibility during the crisis. I will finally mention independent living, the institutionalization process, and living in the community. We got proof, if we needed, of the necessity of the DI process, but it also implies new challenges to deal with in this area. For all these aspects, of course, funding will be key factors. So that's just to give you a clue about what the future disability strategy will have to take into account because of the COVID crisis in another way. Now, how can we ensure that persons with disabilities are not forgotten in the recovery process. First, I would say that it goes through an internal consultation process, i.e. within the Commission services for all Commission proposals related to the COVID recovery. This includes the work of our unit, of our Directorate General, and of course the Cabinet of Commissioner Elena Dalli, who is actively involved in the discussions related to the COVID crisis. Being able to contribute from the disability angle is the only way to ensure that there is, if I can say, a disability check done before a Commission proposal is adopted. Second, we need inputs from external stakeholders, and first of all, from our NGOs as our usual partners. We also need a regular dialogue with them on these issues. We had a fantastic example with the meeting held last week between 2 vice presidents, 3 commissioners, and NGOs representative on the issue of social services to be provided during the pandemic, etc. Very useful, very impressive. But we also use, of course, our regular structural dialogue that we manage with the civil society. We intend to keep this dialogue between the Commission and the civil society regular, transparent, open, and constructive. Third, for me, the participation of the civil society at national level is important in the discussions with the managing authorities for the use of the EU funds. It is absolutely essential that the civil society is present and heard in this framework. Fourth, I think we can also count on other stakeholders, very important ones and very involved in the issue of related to persons with disability and the COVID crisis, COVID recovery, to ensure that persons with disabilities are not forgotten. The European Parliament, the European Social and Economic Committee, the Fundamental Rights Agency, and of course the UN Committee, which is very active too. So they will provide us with important inputs, recommendations that I think would be very useful to us. And for me, it is the only way. It's by working together that we will be able to bring the best response to the current crisis, a response that does not leave anyone behind. So we are counting on you to be part of this process. And I'm sure you will keep on being present and active. And I thank you a lot for that in advance. And I thank you now for your attention. Thanks a lot.
Thank you very much, Emmanuel. Thank you for also disclosing, in a way, some of the trends that you will include in the future disability strategy. Definitely, the crisis has put on the table, as you have mentioned, DI processes, which, you know, in the place that maybe they should have always been. But really, the crisis, unfortunately, really has made this like a more pressing issue. And thank you also for your time and for providing us with these hints as well of this cooperation that should exist also at national level, obviously at European level as well, but also at national level between civil society and authorities. It is the only way in which we can make sure really that the structural funds will have a really proper impact. I know, Emmanuel, that you really have to leave us before the end. So I really thank you for also putting some slot in your agenda to make this introduction and presentation, and also for the information that you have provided that probably we will have the opportunity to discuss at the end with the other panelists as well. So as I said, we have 3 persons from the European Commission joining us. Emmanuel was the first one, but we also have joining by phone Marianne Parasquevas, who is a Senior Policy Officer in the European Commission DG Employment and Social Affairs and Inclusion. So yes, Marianne, you are a little bit far, but in a second, I guess you will get closer to your micro. I see that you also have a presentation, so I give the floor to Marianne. Marianne, please remember to stick to the 8 minutes, please, maximum, so we make sure that everybody can do their interventions. Thank you very much, Marianne. The floor is yours.
Can you hear me? Hello?
Yes, we can hear you. We can hear you. Go ahead.
Okay. Yes. Good afternoon, and apologies again for not being able to be online, but through the phone. So I was asked to respond as to what is the CRI, the Corona Response Investment Initiative, and the CRI Plus, and what does it mean for the European Social Fund, the European Social Fund Plus, as well as for the FAIR, the Fund for the European Aid to the Most Deprived, since all the three funds are very much involved in providing support to persons with disabilities, between others. And Under Urmos from Regio will say the details about the CRI and the CRI Plus. So I will focus more on providing information as to what has been already done for the FAIR within the CRI Plus package, and what is expected to be done in the very near future about the European Social Fund and the ESF Plus. So starting from the FAIR regulation, and we can start scrolling through the presentation, the first slide, for example. What were the reasons to amend the FAIR in view of the CRI? Is to be able to provide that the support that is delivered to the most deprived continue to be delivered in a safe environment. And this means that we need to enable the managing authorities, the partner organizations, who are the key actors that deliver the support on the ground, to react quickly to the emerging needs of the target groups. And of course, people with disabilities are part of these target groups. And also, we need also to ensure that the most deprived that are exposed already to social exclusion have to undergo further hardships stemming from the crisis. So in order to do that, we have to ensure that the response to the COVID-19 crisis through the FAIR is quick and effective. And for example, we are going to do this by having more flexibility when it comes to amending the relevant operational programs, broadening the scope of the eligibility of the program, which is already very broad in its scope, and it depends on the national context, who is eligible and what kind of activities are eligible, providing also liquidity and flexibility in terms of reporting and control and audit requirements, and also align all these with what is provided for in the CRI package. Now, the three innovative responses through the FAIR to the COVID-19 outbreak has been first that the food and basic material assistance, who up until now was not allowed to be provided through vouchers or cards, is now going to be open to be delivered through this means, because this indirect type of delivery can reduce the contamination risk. So as it has been decided by the co-legislators after the proposal from the Commission, these electronic and paper vouchers or cards will be introduced, and all these measures will apply with retroactive effect as of the 1st of February 2020. Now, then other point that is of very big importance in the current situation is the purchase of protective materials and equipment for the partner organizations who are delivering the support. And this action has a double rationale, if you want, because it protects the partner organizations and from contamination when they are delivering the support, but also it allows to continue the delivery in a safe time, because we know, for example, that when it comes to homeless people, it is not easy to go to them if we cannot ensure that there will be no contamination risks, both for the homeless people, but also for the partner organizations who are delivering the support. Now, the third element that is very important to keep in mind is the provision of further flexibility and liquidity. And for this, there are different rules that have been put in place. And the rationale again was to be able, for example, to continue the delivery of support and to delay the delivery of the support even if the operations are suspended for a while. The second element is, as I mentioned, to have lighter control and audit trail requirements, extended deadlines for the managing authorities to submit the annual implementation reports, and also co-financing up to 100% upon member states' request. And all these provisions are in fact a novelty for the fair, but also they are in line with what the CRI package provides for: flexibility and adaptation to the new reality. Now, we are now also faced with the recovery plan that will be put in place soon. And as it was announced already, the multi-financial framework 2014-2020 will be extended in practice until 2022. And there will be additional amount of money, and of course the ESF and the FEAD will benefit from this. And this, however, necessitates to amend also the ESF regulation in this sense, in order to take into consideration the new modalities that will be introduced with the CRI package, but also to manage the new situations that have been emerging through the crisis due to the COVID-19 outbreak. So there will be a request for additional resources, of course, as I mentioned, for the ESF as such, but these additional resources will fund primarily actions to help support the economic recovery by maintaining employment, but also in particular enhancing social cohesion. So maintaining employment will be done through subsidized or the short-time work schemes that we have already introduced with the CRI, support to youth employment, reskilling and acquisition of digital skills, with a view also to have already the link with a more greener and more digital economy. Investments in health and safety at work will be a priority, enhancing access to housing benefits for the working households, addressing child poverty and increasing the capacity of the public employment services who are key actors in boosting employment. Now, there will be particular focus on social inclusion and with a view in particular to tackle the crisis impact that has worst hit households. And this will be also an initiative that will be key for the amended European Social Fund. Now, when it comes to the fund for the European
one conclude, please.
Of the amendments have been done already, but there will be additional resources made available for the years 2021 and 2022 as part of the recovery mechanism. When it comes to the European Social Fund Plus, it will broadly cover the challenges that we have highlighted already in the proposed regulation. And there will be, however, much more focus and intensive support to vulnerable groups at risk of poverty or social exclusion, and also much more focus on persons with disabilities, and in particular on the process of the transition from institutional care to community-based care services, home and family care services. This also applies for long-term care. And what we want to promote even further is centered, integrated support through better integration of healthcare and social care services. So the third question that I was asked was to report whether this new approach will have an impact on the thematic concentration on social inclusion. On the contrary, in the new crisis context, it's even more imperative to support the vulnerable groups and those who are facing the greatest risk of exclusion. So the Commission itself will propose an increase of the minimum share on social inclusion from 25% to 27%. And this should be allocated for social inclusion. It will also ask for an increase of the percentage that is currently allocated for the aid to the most deprived under the current proposal, and it's 2%. We will ask to be increased to 3%, and these are also the requests that have been put forward by the European Parliament in its opinion on the future ESF plan. And there will be also an earmarking to tackling child poverty, and there will be also the earmarking for youth employment. So social inclusion will be further boosted. So, and we hope that this will respond to the expectations also of our partners, the civil society organizations, and the social partners. And of course, when it comes to the policy framework, this will be all rolled out in line with the European semester challenges and with respect of the principles of the European Pillar of Social Rights. So this is, in a few words, what will be the future of our funds. And if you have questions afterwards, happy to respond. Thank you.
Thank you very much, Marian. Thank you for trying to, it is difficult to condensate in just some minutes all these measures. And I think for sure we will have the opportunity to assess a little bit initially these measures from all other speakers that will speak from now on. I will give the floor now to our third representative from the European Commission, Andor Urmos. He is a policy analyst from the European Commission, the Director General for Regional and Urban Policy. Andor, please, let's try to stick to the time so we make sure that everybody can intervene, and we also, very importantly, give the opportunity for the participants to ask questions. So please, the floor is yours, and we are happy to listen to your presentation.
Thank you very much, and let me welcome everybody in this webinar, and thank you very much for the opportunity to speak about this very important question, and in particular, let's say, the use of EU funds in this field, because we see plenty of areas where actually as it was said before, where EU funds can make really some very strong and even some quick help to respond to the challenges what we are facing today. I prepared a few slides. I will not go too much into the details. I would just like to highlight that what's really happening now in the Commission, together, how much we are working together with member states to find the best response to the current challenges. If you go, thank you very much, to the first slide. So here I just wanted to, let's say, highlight that the Commission launched a very specific initiative, which we call Coronavirus Response Investment Initiative. And you see here the link, what you can follow. And under this link, you find all the updated information, actually, what's really happening. What is very important, that at the beginning of the crisis, we try to explore actually the needs, what member states and other stakeholders would like to do, or they would see actually as a problem, responding to the crisis. And that's why we had some direct contacts with national regional authorities. And one of the first, let's say, important measure was from our side to make the European funds programs as much as possible flexible and to make it quick in order to respond to the challenges. If you go to the next slide, then basically I just give you again some very, very basic information. So in March 18, two commissioners for responsible for employment and for regional development, they co-signed a letter, and it was sent to all member states. And the Commission raised the question about the use of EU funds as much as possible to be used in response to the crisis. One important question was that the money which is available in 2020 should be available immediately, because we have some, let's say, financial regulations, financial requirements, but all of these requirements are relaxed now. So it means that member states, they can use immediately the funds. So the amount of money which was highlighted actually in these letters, in these country-specific letters, this is the money which is available for member states immediately. There were some questions actually, how much is in an additional budget? It's not an additional budget. It's much more, let's say, easy to access funds, because again, the financial regulations, the financial requirements are relaxed. So member states, they can use these funds immediately. The other important question was that how much we would like to change the European funds regulations. And as you can see on the slide, the first wave of modifications has been already adopted, and here we introduced some flexibility rules, again, in order to use the funding as much as possible flexible and quick. If you go to the next slide, you can see here actually some of the, let's say, new measures. I really don't want to go to the details because I think it's not the right time to discuss even the technical details of the changes. But one is important here, that we always have this kind of difficult or administrative procedures to modify the operational programs, the EU funds programs. It takes time and it should follow actually some administrative requirements. This is not the case anymore. because if you see, actually member states, they can modify the operational programs immediately. So without even actually, they don't need actually the Commission decision, Commission approval to modify the programs. The eligible costs are available as of from 1st of February 2020, as you see here on the slide. So it means that actually we are happy to finance the costs which have been occurred actually in February, March, even if the regulations have came into the force, let's say in April. I'm responsible for the European Regional Development Fund, so I should highlight some of the new measures here. So the ERDF, it refers to the European Regional Development Fund, which you see in the third bullet point. And this is, and we changed the regulation for the ERDF, which is about actually to use the ERDF in a much broader context as response to the crisis, especially in healthcare. So the crisis capacity of healthcare has been very much extended. So in all area, almost in all areas of the cohesion policy, basically you can use, you can respond to the health crisis. And the other important question, what was raised by member states, to use EU funds to for the recovery, for the economic recovery, which Marian also mentioned. The point would be here that the ERDF will be used in a more flexible way, actually in small and medium-sized enterprises, and also the financial instruments, which is a very specific part of the ERDF, can be used for responding actually the crisis in small and medium-sized enterprises. If you go to the next slide, you can see that we are now working on the modifications of the new programming ready period, which means the 21-27 regulations. Most probably next week, some details will be already available, how much, let's say, the new regulations will be changed. The point would be, again, how to respond to these challenges, to these potential challenges in the future, how to be ready actually to any type of crisis, pandemics in the new structural funds regulations. It's not an easy question. And I can tell you one point probably why is it not an easy question. Because as you may know, that one of the important requirement of the cohesion policy is to look at the midterm or even the long-term perspective, strategic frameworks, what we call ex-ante conditionality or enabling conditions. So member states have to provide the necessary frameworks, strategic frameworks in social care, in healthcare, in education, in respect of the deinstitutionalization, what they are going to do in the upcoming years. But they have to somehow include the potential crisis in this midterm or long-term perspective, which is not an easy question. So that's why we try to find a solution actually to this, that even if we are requiring the strategic frameworks, how to respond to any potential crisis in the future. In the letter, what I mentioned earlier, which was sent to member states in March, we highlighted a particular focus should be given to vulnerable groups. And here I just highlighted a couple of, let's say, potential target groups, what we see as they are these people, they are facing some particular risks in the crisis. It's homeless people, people who are residing in institutions, long-term residential institutions, and people who are facing difficulties actually accessing water supply, sewage, and it's particular actually this is a problem in so-called segregated Roma ghettos in Central and Eastern European countries. And in all of these areas, we are trying to explore how much member states they want to respond to these challenges by the EU funds. We have seen already some examples, and in the next slide, I just want to show you two, let's say, examples. These are two ongoing negotiations. One is Slovakia. In Slovakia, with the European Social Fund, the government is focusing on Roma settlements, as they see that there is very important access problems to the basic utilities, facilities. And as you have probably seen, there are particular questions actually with the digital education, as some of the vulnerable groups, marginalized children, they don't have the necessary equipment or access to broadband facilities. So their access to digital education can be very much broken. So this is also something what we can, or we should probably tackle with the EU funds. So how much mentors or even equipments can be provided actually to the marginalized communities. And another example here is Poland, where all the regional operational programs will be amended. And there are some ongoing discussions about the extension of the capacities of healthcare services, hospitals, outpatient clinics. But it's very important that we are responding to, let's say, to the crisis. So we are not reforming now the health system. The point would be that we are really responding to the crisis situation. And here I would like to highlight one more angle, which we probably
Under 2 minutes, please, to upload.
Yeah, so I'm finalizing. One more angle is that what's happening in the elderly homes or social care homes. As you have seen, probably there are some very alarming figures about the number of deaths in care homes, and how much the EU funds can respond to these questions, even in the short term, or let's say, what is our perspective for the future actually about these elderly care homes, because we need to understand that if EU funds are allocated actually to these homes, then what is the best perspective or best alternative to elderly care homes. The next slide is just a thank you very much for your attention, and I'm happy to respond to your questions. Thank you.
Thank you very much, Andor, and thank you for very interesting presentation. Definitely, it is also good to know that some lessons are being learned for the future programming period, which I think is also very important, that we take some examples or some lessons that has to be learned from the current crisis. Let me just, before we move to the next couple of speakers, I mean 3 speakers still we have in a row, but some of the words that I have taken from the European Commission interventions is quick, effective, flexible, easy access, simplified procedure, which really are really great and really, let's say, principles which really should and definitely have guided the European Union when reforming and flexibilizing the instruments. But now we are going to move to some of our interventions going to the countries. And we will have 2 countries, Spain first and afterwards Latvia, and they will present to us also their view from all these changes and ways in which flexibility is being provided for the new fund. So I would like to give the floor to Maria Tusi, who works in our foundation in European programs, and she is really an expert in all issues regarding the implementation of structural funds regarding persons with disability in Spain. So, and I would like to thank Maria also for being available for this webinar. Maria, please, the floor is yours.
Okay, thank you very much, Javier. I hope everybody can hear me. Thank you very much for organizing this interesting webinar and for all the interventions, all of them very interesting. Well, I was asked to give some answer for 2 questions regarding the new measures adopted by the European Commission regarding flexibility. The first one is about the new commitment of 100% co-financing from the Commission, and if this commitment open up new opportunities for investment in persons with disabilities. Well, the first issue I would like to make clear is that the 100% co-financing is not an increase of the ESF amount for beneficiaries or for intermediate bodies, but is financial liquidity for them. That means, in practice, that the total cost for a project is now, or would be now, the ESF funding. For example, if the co-financing rate is up to 75%, it means that you can carry out projects of 75% of the total costs. This new commitment, if member states embrace it, could apply for all the reimbursement on an intermediate body or beneficiary makes during the 1 year. specifically the Commission accounting year coming from June to 2020, June 2021. So, taking into account that this unexpected situation, incomes are small and expenditure is growing, it is a clear opportunity for intermediate bodies and beneficiaries to maintain the activity that would otherwise should be postponed or even gave up because of the lack of liquid assets to guarantee the compulsory co-funding of the projects by the member states, the intermediate bodies, or even the beneficiaries. It is also a good opportunity for all the beneficiaries whose employees are affected by the COVID crisis in the form of permanent or temporary layoffs and short-time working is our case in Spain with the ANCE Foundation. We are an intermediate body of two operational programs, one of social inclusion and the other one of youth employment. So it's an opportunity because we are not obliged to justify until 100% of the ongoing projects for persons with disabilities. Maybe they are not new opportunities, but at least beneficiaries can keep on offering employment guidance and job training for persons with disabilities. The second question is which things we need to be careful about regarding this new flexibility in EU funds, and how can we make the most of it to support persons with disabilities in recovering from this crisis? Well, the biggest challenge we face is to be more imaginative, as we have to maintain the activity and we can abandon our beneficiaries. We have therefore to adapt and to introduce new ways of working. Several measures have been adopted by the Commission regarding flexibility. Some of them have been mentioned before. First, possibility to adjust operations, for example, regarding deliverables, time limit for execution, etc. Secondly, national authorities have also the possibility to select new operations. For example, if as a result of the impact of the COVID outbreak, there is a need to interrupt or stop the implementation of operations. This is in order to effectively use available resources and to achieve the targets set for the program. This is a clear opportunity for new projects for persons with disabilities if needed. The third one is concerning the public procurement rules. The negotiated procedure without prior publications may be used as it is strictly necessary because of extreme urgency. This is crucial, for example, for hiring training courses, to buy tablets or internet connections, taking into account accessibility for the continuity of the activities with persons with disabilities. And the fourth one is that financial corrections shall not be applied and indicators may be modified and adjusted. The Commission has, however, recalled that although there is some flexibility, the legislative framework for the implementation of operational programs remains fully applicable, even under the current exceptional circumstances. So we have to be careful because there will be audits regarding each application for reimbursements by beneficiaries. Therefore, all beneficiaries, as we have done, should adapt their evidences, audit trails to the new ways of working. For example, connections of the students to the online trainings, evidences of the telework as costs of staff dedicated to ESF programs is eligible. Persons with disability are the last to have employment opportunities in normal times and to get a job, but the first to lose it when a crisis comes. But we also know their resilience. So we are also aware aware that we are facing in Europe the deepest financial crisis, with a huge unemployment rate, probably unknown for our generation. Therefore, it is a big challenge, but we can use ESF to strengthen training, particularly in technologies, adapt operations to help the maintenance of employment, and to reinforce orientation and labor intermediations with companies to convince them that the talent of persons with disabilities can help to recover from the crisis. And I finish my intervention with a reminder that the ESF should play a similar role as in the financial crisis of 2008, when the flexibility in existing programs and in reprogramming enabled swift responses to emerging challenges, in particular those created by the severe economic crisis. As such, ESF helped and now should do the same to mitigate the negative effects of the crisis, which especially affected, like now, the most vulnerable groups in society, such as persons with disabilities. Thank you very much.
Thank you, Maria. Your time was perfect. Thank you very much. Thank you very much. And even more important, the content was really very interesting. Thank you, because it really reflects the efforts that an intermediate body is doing now in the case of Spain, but it happens, I'm sure, in all European countries, to adapt to these new flexible measures, and at the same time to really try to get to persons with disabilities and their needs in this really challenging period for all of us. But now we are going to move to another country, which is Latvia, who has also, and Guntanka will be the one in charge of the intervention. She's the president of the umbrella body for disabled people organizations, for persons with disabilities in Latvia, Sustento. And she will introduce to us the case of Latvia and how they are trying to adapt to this new context of structural funds and other funds or European funds in Latvia. Thank you very much, Gunta, for being there, and the floor is yours.
Hello, and it's really nice to hear all you today, even in my computer, but not in real life. But I hope we'll meet soon anyway. So I try to explain you a bit situation in Latvia regarding European structural funds and funds in general. As you know, the situation in Latvia is the same like everywhere in a European Union. So as just my colleague from Spain said, very many people with disability lose their jobs. So the number of unemployed people with disabilities are rising very, very fast. Children with disabilities have not possibility to go to schools, and it means that their parents should stay at home with them, and it means that their parents lose their jobs because they are not just able to go to work. And also daycare centers are working in a remote way, so it means that the staff of the daycare centers calling to those people at home and trying to manage them. And it's still a lot of problems, and many of their parents or relatives should be at home and not to go to work because of that. So situation is quite bad, and we have heard quite a lot about it. The situation is quite bad not only for people with disabilities, but also for the organizations with disabilities. And even many times we have heard the word flexibility. In my small presentation I prepared for today, I put that there is no flexibility when we are talking about European funds. We have started our crisis situation in Latvia on 12th of March. So now we have almost 2 months, a bit more, but still we are talking that support is needed to the organizations who are using European funds, and still our government said, yes, of course, that is okay, we are absolutely agree with you, but we don't think you can get money because it's European money, and European money cannot be used in any other ways just like it's said in instructions or rules and so on. So all those issues to help organizations, to support the organizations by trying to change the services. For example, we have a mentoring service for people with disabilities, which could be possible to do by phone or by virtual meetings. They are not allowed, but at the same time, there is any other ways how to do it. So it makes quite a lot of problems for the organizations of people with disabilities. And even we are trying to do it very proactive. And even we are preparing, I don't know, maybe 3 or 4 letters every week, and everybody knows about us. We still have a very, very slow way to change the situation. Because in general, in Latvia, we have the feeling that the most important part is entrepreneurs. Our entrepreneurs, they are those who need a really get very fast support, but organizations, even those who provide services, shouldn't be supported. And nobody can answer us to the question, who will provide services after crisis, when those services will be needed even more if you are not supported those organizations at the moment. We also have a special dotation to the organization, which is for different activities and to support interests of people with disabilities. Those dotations include special activities. So it means if you are not able to implement those activities, you are not able to get a dotation, and that is quite difficult. One more big problem with the project money. For example, we have Interreg project, which has a period of 6 months. And so it means you make an implementation of your project. You put in your own money. There is no advance payment. But after that, you'll get back your money. In a situation where organizations don't have any money, it's not possible to get advanced payment. So it's not possible any implementation of the project, even it's very important, even it's about education of young people with disabilities. Even we see how good we can do starting from September, a real training for those young people. So we cannot do anything because we just don't have money we can use for the project activities. The next question is, how do we feel what's gonna happen after the crisis? And of course, we have a feeling that crisis is going down. I really hope so, and everybody hopes in Europe so. And the situation it's getting better and better, but at the same time, the main idea of government in our country is that all European money should be used for heating economy. And when we are asking what does it mean, heating economy, they are saying it's everything around you, for example, building new roads, building new buildings. It's nothing again about social services, social projects, support projects for people with disabilities. And we have a feeling that's gonna be a real difficulty to change the situation and to get some kind of support of European money for those, like say, soft projects, which are so important for people with disabilities. And as you know, we don't have a quota system in Latvia. So those people who lose a job at the moment, it means there is no any system how to get a new job for them. So it means that support for them should be even higher and even bigger to try to involve them in open labor market where so many people without disabilities are looking for a job. And if you're asking me how I see some kind of solutions, one of them is quite important to include a new period of structural funds, very strong criteria that some part of the funds should be used for people with disabilities, for vulnerable groups, and that member countries cannot change it. They can get the money only with those rules. So if they are using the money on that way, they can use any other money of it. And very strong and very effectively, monitoring should be made also by involving local or national disability organizations. Because of course, you always know that there is one kind of report which is provided by the state, and the situation could be very different if we are looking from the point of view of organizations. The two most important parts are education, employment, and of course the institutionalization. And even we are very happy in Latvia that we don't have many cases in institutions like Greece. Still we have a feeling if something would happen in those big institutions there are about 500 people, it would be a real tragedy for a country. So it's a very good time to start thinking in a different way. And it's very good time to support all those services we have already. Because it's good to start something innovative, but it's good to keep those services we also have by the support of the structural funds, which is very important. And thank you very much for organizing this really interesting webinar, because it's a great possibility to see different people, to have a different point of view, and also to hear the point of view of European Commission, because it gives us possibility to go to our government and say, no, it's not European Commission who say you can't do that. It's you who wouldn't like to ask them for the possibility to change something. So thank you.
Thank you very much, Gunta. This was also very interesting to know the experience in Latvia. And let me just go back to some of the words that I highlighted before, because you remember I had highlighted flexible, quick, easy access, simplified, etc. And now in these two last presentations, I have highlighted not very flexible, slow, difficult to communicate, difficult to adapt. So this is really interesting to see sometimes the mismatch between the implementation, the real implementation, and has been really the principles that with which everything has been thought before. So now we'll go back again to Europe, and we'll go to our next speaker, the last one, Luc Selderlo, who is the Secretary General from the ESPD, the European Association of Service Providers for Persons with Disabilities, and he will provide us with the view from the service provision and how they see also this new context of structural funds and the flexibility measures. Luc, please, the floor is yours.
Thank you very much, Javier, and I would like to thank the ONCE Foundation and EDF for offering me the opportunity to speak here at this very important and interesting webinar. I prepared a little slideshow, but I will not use it, just to cut a bit in the time that is needed. So maybe there is still a bit of time then for questions, and the organizers can provide this PowerPoint later to all the participants if they think it is useful. Indeed, I represent here social service providers, ESPD, my organization, and although I'm tempted to also speak about employment and the impact of the crisis on the employment opportunities for persons with disabilities. I will not do that. I will focus on the social services. And since day one of the crisis, since early, well, I must say in February, early March, we are working very hard and try to support social service providers across the European continent, because we think that social services are a tool to empower people so that they can live the life they want to live, and therefore they are essential services. And what I hear from the grassroots level, from these services, from the managers, from the staff, from the people supported by the services, is that this essential support can quite often not be provided anymore, and that is creating huge difficulties. I hear three different messages. First of all, a very positive message. I hear from the sector that there is a huge level of creativity in adapting the services to the new reality. So many organizations go online, provide platform support, do distance support and all that. So very positive, very creative. I also hear a lot about the huge commitment on how professionals, family carers, neighbors, brothers, sisters work together to make sure that children with a disability or persons with support needs are supported in a correct way. These are two positive elements, I think. But I also hear way too much horrible stories, really horrible stories of people with high dependency needs that are left on their own in institutional settings, sometimes also at home, no support provided. Families that are not supported in providing the needed care to their family members, elderly people that are left alone, people that really can't leave their homes and their houses anymore due to the lack of support, due to the fact that staff rates go down, due to the fact that people are sick, and so and so. Horrible stories, and this should be stopped, and I think that Europe should play a role in that attempt to stop this. What are the needs? There are still three types of needs, I think. One, personal protective equipment for both the people supported and their support staff. Still, there are not enough masks, there is not enough disinfecting gel, there is not enough protective equipment. Second element, extra costs for staff, because we have to replace staff that is not available anymore due to sickness, due to the fact that they can't work anymore. This extra cost is not covered, and organizations, mainly not-for-profit organizations, struggle a lot to deal with this cost element. And the third cost is the costs that are generated by providing these more innovative service models. The Corona Response Initiative, the famous CRY and the CRY Plus, indeed is set up with the best possible intention. But I must, in a way, echo the message from Gunther and the message from Maria. And yesterday, my team had contact with 7 different managing authorities across Europe. And in fact, these managing authorities are not really interested in changing their operational plans. They are not that interested in the modification. They are not that interested in the 100% co-funding rules that are changing. They want to stick to what they have at the moment. So this 37 billion most probably will not reach our sector. And to adapt the CRY and the CRY Plus, we should, I think, set up a help desk that bridges the gap between the good intentions of the European Union and the ESF team and the ERDF team and what is happening on the ground. If we don't bridge the gap, I'm afraid that it will not happen. We have to help promoters to unlock these resources so that their urgent needs can be dealt with. What could help to do that is also setting up an emergency fund for social services. It is done for the health services. So why is it not possible for the social services? we consider social services as essential as the health services. So it should be possible to set up an emergency fund for our sector as well, so that we quickly can respond to the enormous needs that we see in the field to help promote the access to protective equipment and to cover the increase of the costs. What do we need in the long term? And we should indeed, as rightly said by the EDF President, Yannis Vardakastanis, we should also look at the long term here. And there my first concern is, the moment that there is a vaccine, will all European citizens, whatever their support needs is or their position in the economic world is, will they have equal access to it? Will it be affordable? I think that we as a disability movement should start working on that. For me, that is a key debate. Second element, and it was brought up already, we have to protect the ESF Plus and the ERDF budgets. These budgets should be increased, and we should make sure that the needed measures are taken so that we can develop empowering projects also for persons with disabilities. And you might have noticed that on one of the presentations that we have seen a few minutes ago, services for persons with a disability were not even mentioned. So there is a real issue there, and we should continue working on that together. We have to have a clear commitment also, that's my next point, of the European Union, that these funds will need to support innovative models, that we don't invest in outdated support models. Last but not least, and that is a real concern, we should try to avoid that we go again in a sort of an austerity mode, as we have seen in 2008 and 2009. The economic recovery measures should not go at the cost of persons with a disability and their support services, and it should not go at the cost of other support services that need this type of interventions. So in the long run, we should make sure no new austerity on our sector. What I think, and I hesitate, and I wrap up, Javier, I hesitate saying this. In fact, I'm deeply disappointed because the European Union did not use its full capacity to support people with support needs and their services. I really think that the European Union should make itself more visible, should show stronger commitment, and should bring real change. We need an emergency fund, and it should be feasible to do that. The crisis is now, not in 2 years from now. The crisis is now. We should have an emergency fund. We should facilitate access to the CRI 1 and the CRI Plus, and we should protect the field from austerity and exclusion. So thank you very much for offering me the opportunity to speak, and I really hope that this type of webinars will contribute to raising awareness and to making clear what the real issues are at grassroots level. Thank you for listening.
Thank you very much, Luke. Thank you for that very clear explanation of the challenges and also what you have detected. You know that are really the problems, challenges as well, and the needs of the sector. Let me just, first of all, ask to our interpreters and captioners to stick with us at least 10 minutes more, so we can have just some, thank you very much, Ferdinand, for your acceptance. And then we will have to at least from the many questions that we have received, I beg the pardon for all those if I don't take their questions, but I'm gonna focus on 3 main questions. And I would like, first of all, I will ask all of them, and I will give the floor to all the speakers that have intervened on the different parts of the webinar. First of all, for the European Commission, and I would like to see if Marianne and Andor can really focus just 3 minutes each on this. There is a lot of questions. There are a lot of questions about the institutionalization. How we can make sure that this crisis cannot really help, first of all, to modernize current institutions, because there could be a temptation on that. As well, if we can really make sure that now we invest in transition after all the deaths that has appeared in institutions. And the third one is how we can really make sure that from now on we invest in community-based services. This is really a question that I would like to the two of you. The second question would be really focusing for Maria and for Gunta. What could be your request, your priority at European level to make sure that at national level you can have really a proper implementation of the funds in your two countries? I mean, what would be, in just one sentence, what would be your main priority for both from both countries to the European institutions? And the third one for Luke, if you could maybe provide some details, not too long details, but just maybe 3 or 4 characteristics of this emergency fund that you are proposing to be created at European level. So I would like to ask Marian and Andor to answer the first question, and please try to stick just to 3 minutes each of you, please.
So
I would
if
say
I
that Marian, you start.
I would like first of all to respond to what Luke said, and in fact, because we have sensed that there will be resistance from the managing authorities, we've already established a list of activities that the European Social Fund and the FEAD can support. And we are very imaginative, and these are indications, and member states can exploit these even further. But unfortunately, we have seen, and I already mentioned this, from the implementation at the level of the member states records that we keep on a bi-weekly basis, that nothing has been done at national level from the majority of the managing authorities. Status quo, for example, in Spain and in Malta, the response was that all the additional ESF money will go for supporting short-term work schemes. ESF Flanders, and we know what is the situation here in Flanders, responded that we were planning to have an operation on well-being, mental well-being, but we decided to postpone it to the next programming period. So we are really trying hard, and we are really also trying hard to find a response to Luke's and all the other colleagues' concerns regarding the situation of the social services. We also hope that the crisis now has proved the importance that the social and the healthcare sector have for a variety of groups, and we expect that this also will result in a revalorization of the role of those who are involved in the workforce. And when it comes to the transition from institutional care to community and family-based care services, for us it will be a priority. For the ESF Plus, it will be a priority, and I mentioned it already, and also with an approach that is person-centered, and the phone is not what matters, it's the mentality that matters. We don't want to have this institutional mentality anymore. Person-centered approach, integration of services, looking at the needs and expectations of the end users, and this will be the line to take for our investments in the next programming period.
Thank you, Marian. Please, Andor.
Just to be very brief, what is very important to understand now that all the EU funds programs, actions should really respond to the crisis. So that's the main objective of even for the program modifications. We are not aiming for, we should not aim for anything else, just to respond to the crisis. It's very important to understand, because if you ask, let's say, even service providers or other stakeholders, they are arguing that they would need more staff, for example, in disability homes, in even large residential institutions or elderly care homes, which is absolutely understandable because of the crisis. But it doesn't mean that we are not we are dropping the line about the deinstitutionalization. Absolutely not. So you see, the crisis would probably trigger some, let's say, investments in institutions because of the staff. But it doesn't mean that we need to extend, for example, let's say, the physical capacity of institutions or something like that. And as Marianne said, actually, for the next programming period, it's obviously nothing to do with residential institutions. It's the main focus is community-based services as much as possible. So we should really differentiate these two, let's say, perspective. One is, again, the crisis, and the second one is a long-term perspective where the DI should be followed as much as possible. So we are not dropping this line, and absolutely not, let's say, we are not aiming for extending the capacities of the institutions. What I would like to highlight here, one more sentence, is that I would like to invite all the colleagues who are listening us today, that they are contacting actually the managing authorities or national authorities in general, and they are discussing actually with these authorities what they really want to do and what they are planning to do in the scope of the EU funds, because we cannot really, let's say, decide what's necessary, what should be done in Bulgaria or in France or in Hungary. That should be, let's say, decided at the member state level. But colleagues who are working very closely with the member states, they can help, and they should probably, let's say, come up actually with their ideas and suggestions. Thank you very much.
Thank you very much, Andor, for that question. Definitely, I mean, DI requires really big efforts to make sure that it's not really supported in many different ways from the funds. But let me just ask then Maria and Gunta. First, Maria, please, if you could give us a message that you are expecting from Spain that should be coming from the European Union institutions regarding structural funds and their implementation in your country. Please, Maria, first.
Yes. Okay. Thank you, Javier. Well, my priority is almost a dream, I can say. No, yeah, today we have received a communication from our managing authority, the ESF managing authority in Spain, giving us the possibility to reprogramming the operations we have implemented as beneficiaries in terms of indicators, reschedule activities, and the annual distributions. But I would like to have the 100% co-financing, not only as liquidity, but really much money for the institutions and the entities. We are working with people at most risk of exclusion, and we know they are going to suffer much and more this crisis. And another priority, but unfortunately, because of the territorial organization of Spain, would be impossible to do that, is that the Commission has given the possibility to change funds between regions. And unfortunately, in Spain, this would be impossible. And that is going to be something very bad for persons with disabilities. We are not going to work with them in regions like Madrid, where the co-financing rate is only 50%. Only with 50% we can work with persons with disabilities. So maybe this 100% co-financing in some regions would be very good in Spain. Thank you.
Thank you, Maria. And Gunta, please, the floor is yours.
Thank you so much, and thank you for a question. It's quite difficult to prioritize something one of all I've said before, but for me, the most important point would be to giving the right information to the member states and to the national bodies of disability organizations in the member states. Otherwise, we have a quite strange situation we had today already, when the people from Commission speaking about the really nice things, and we from countries like Latvia and Spain talking about absolutely different situation. And there are so many small pieces we are not able every time to go to Brussels and ask. So try to manage the bureaucracy, make a little bit lower. For example, when we have a meeting to moderate our people with disabilities who are employed, our organization who arrange the structural funds said you can do only when you have a sign of European structural funds behind you. If you don't have a sign behind you, you cannot do it. And when we are saying we would like to go to the places which is nearby the people, maybe in the parks, so they said you should take the sign and put on the behind you somewhere just to see that European structural funds are those. So there are so many small, very stupid things, very bureaucratic things. I don't know how to change it, but we should change it, otherwise it looks a bit funny, but really bad. And I hope we can work very well together to change the situation. Thank you.
Thank you very much. I think this brings us back to the proposal that was made by the president of EDF of a communication, a clear communication from the EU leader institutions from the institutions to really make sure that the message is clear to the states. But now let's give the floor to look in this emergency fund that they are proposing and maybe some hints of that fund. Luke, the floor is yours.
Yeah, thank you, Javier. And I must say that I really fully support what was proposed by Yannis. Indeed, the European institutions should come with this very clear and strong message. Before turning to the emergency fund, maybe in reply to what Ander almost said on the extra staff, when I talked about the cost for extra staff, I was not in the first place thinking about institutions. I was thinking about family support, community-based services, personal assistance, educational services, essential services to be able for persons with a disability to live a decent life. I was talking about the extra cost for staff to provide that type of services. The emergency fund, okay. We know that the European machinery is not really very well equipped to act very fast. It's clear that the rules are there, all the bureaucratic processes are there, and at the end of the day, we are not the financial sector. So we understand that things go slow and take time. So that is well understood, and that is exactly, I think, why we might need this emergency fund, because this emergency fund should take a shortcut, bypassing different levels of decision making. Also the levels that quite often make that things are very complicated and that simplification then afterwards is needed. It should bypass different levels, and according to me, it should be direct between the Commission, European level, and the grassroots level, those that really provide the services, the support at grassroots level. Direct to cut out all the red tape, all the bureaucratic processes. And this idea is not just an idea of ESPD or of myself. No, this idea is already discussed with European Social Network, with the social partners, EPSU, and the social employers. So there is in the sector a consensus around how this emergency fund should look like. And one of the things that this emergency fund should do is come with sort of pre-agreed templates for projects, so that people just have to fill in, or can be supported by a help desk to fill in basic essential information, and then the stamp on it, and that's it. It should go then much faster, and it will go it will reach then the grassroots level. Well, that is what an emergency fund should do, to be able for service providers to buy protective equipment and to deal with extra costs that were not foreseen in the way they were operating. And I think that in this type of emergency fund, it is of course also absolutely essential that the people that benefit from these type of services should also take part in the setup and the management of such a machinery. But that is what we need, I think, if we want the CRI and the CRI Plus to work. And it is possible to allocate, I think, the needed resources to make it fly, as they are doing for the health sector. I hope that is more or less clear, but we have more elaborated ideas on that if you're interested. Thank you.
Thank you very much, Luke. Thank you very much to everybody. Let me just finalize this webinar by obviously thanking our speakers. I think all their interventions were very, very, very interesting, and I think they have really helped to identify really important challenges in the process. I think it is an example of dialogue between European institutions and between stakeholders, and I think this really shows that the progress just can come through dialogue between different stakeholders. Let me just finalize by saying what the president of EDF mentioned at the beginning. We are really probably in one of the most important challenges after the Second World War, and definitely we need to have a European strategy responding to that challenge. So definitely through dialogue, I am sure we'll get there. Let me thank all of you on behalf of the European Disability Forum and the ONCE Social Group, and I really hope that we can see each other very soon, either through the webinars or in physical possibilities. Thank you very much, and see you all soon.
Thank you. Thank you very much.
Thank you all. Bye.
Thank you.
Thank you. Bye-bye.